Here are the reasons why you should not treat yourself for positional vertigo. One, there are 6 places called canals that the calcium carbonate crystals can get dislodged into. Which canal they go into requires a skilled, experienced specialist. And keep in mind, many canals can be involved at the same time. So any combination of the 6 canals can be possibly involved. So how likely are you going to be able to figure this out looking off of a sheet off of Google or looking on YouTube? Two, if the treatment is done incorrectly, you can increase the chance of moving the crystals into other canals, which can make you feel worse, more debilitated, and can make things more complicated for healthcare providers to diagnose and solve the problem. Three, since the testing and treatment for positional vertigo often requires the person to feel rotational spinning during the treatment, the person can become unaware of their surroundings and even fall off the bed or the table, and resulting in injury. We've even heard about specific cases about this, so you don't want that to be you. Four, just because you are experiencing rotational spinning does not mean that you have positional vertigo. Symptoms of rotational spinning can be emergently life threatening and be part of another neurological condition that requires a doctor to diagnose and treat properly. So, if you go with this symptom not getting treated, this could actually be life threatening. Five, people's responses to testing treatment for positional vertigo are quite varied, and it can be very unpredictable what the person's response will be. So, throwing your family member into this position to take you through these maneuvers may not be the best route for either of you. Six, another possible diagnosis for your symptoms could be an infection or inflammation in your vestibular system. So then you can also feel this rotational spinning and dizziness. So treating this condition like positional vertigo can make you feel horrible and just be absolutely torturous. So it's not necessarily for you to suffer like that. Seven, your positional vertigo could be part of another vestibular or neurological diagnosis. And sometimes even 2 or 3 of these diagnoses can be happening at the same time. And by not getting a proper diagnosis of multiple diagnoses, you miss out on appropriate diagnosis and treatment that you really need. And as a result, you can end up suffering for years and possibly even the rest of your life if you don't get these other diagnoses treated. And lastly, number 8, there can be after effects from the positional vertigo itself, and you need a specialist to help you if that were to happen. That way, you don't continue to suffer from these problems for months and even years.